Prime Minister set out his response as the number of cases here jumped to 51. He warns there'll be more.
It is highly likely that we will see a growing number of UK cases. And that's why keeping the country safe is the government's overriding priority.
Big gatherings, schools, public transport and workplaces all likely to be hit in some way by the outbreak. We'll be speaking to a former GP about his thoughts on plans to bring back retired healthcare workers to help out the NHS and whether he'd be prepared to return.
It would have to get to a certain level where we were almost in a blitz mentality.
As the Bank of England warns of a large economic shock caused by the crisis, we look at what impact that might have on you. And what does the outbreak mean for major sporting events? Could we see cancellations? You're watching a 5 News Tonight special, Coronavirus, the UK prepares. Good evening. The government has revealed its plan to deal with the coronavirus epidemic in the UK. Today, the number of confirmed cases reached 51. But the Prime Minister says that's highly likely to rise and the country should prepare for all eventualities. At the peak of an outbreak, up to a fifth of workers could be off sick. Police could focus only on serious crime with the military drafted in for support. Non-urgent NHS care could be delayed and retired healthcare workers called back to work, while schools could be closed and public gatherings cancelled. The key word there, could. Our political editor Andy Bell reports.
From big days out to school to work and how we get between them all, the country's been put on notice today that the coronavirus could soon be having a profound effect on the way we live our lives. The government says as many as 1 in 5 workers could be absent with the infection when it's at its peak. But the Prime Minister today, flanked by the Chief Medical Officer and the Chief Scientific Advisor, wanted to sound reassuring.
But I fully understand public concern, your concern about the global spread of the virus, and it is highly likely that we will see a growing number of UK cases. And that's why keeping the country safe is the government's overriding priority.
As well as research, the government plan contains 3 stages: containment, delay and mitigation. Currently, we're in the containment phase, where people with the virus are either isolated in hospital or at home. The next phase is delay, where schools could be closed or big crowd events could be cancelled to slow down the spread of the disease. The most serious phase is mitigation, where we would be coping with a widespread outbreak, and that could mean police having to concentrate on serious crime and public order. Hospitals would have to change protocols on who is admitted and who might be sent home earlier than they would have been otherwise. So could the NHS really cope?
What operations will not happen, for instance, what treatments will not happen, if we move to a stage where you could potentially have tens of thousands or hundreds of thousands of people having to be treated in hospital?
What we will try and do is, in a sense, be prepared to slow down or postpone anything that is postponable. This is normal medical practice, is to actually basically you adjust what you do clinically to the particular group of problems you've got in front of us. And that's what the NHS will do, as any group of doctors would do, any group of nurses would do.
The government's also working to what it calls a reasonable worst-case scenario for the number of deaths.
Yes, it's roughly around 500,000 or so, but most of us who work in this area think that the actual what is likely to happen is likely to be significantly less than that.
But the Prime Minister believes the country can face this.
I do think that this is a national challenge, and I do think that we are faced with something that could be, the potential is there for this to be something that our country has to get through. But I've got absolutely no doubt that we have the resources, we've got the health service, we've got the expertise to do it.
Today's plan acknowledges we can expect significant and clearly noticeable pressures on our services and society, but the government insists it is getting everything in place to cope. Andy Bell, 5 News.
Well, a great deal of information there from the Prime Minister and medical experts earlier. He spoke for around an hour. Let's talk to our panel now, though, about what they thought. I'm joined by the former GP and British Medical Association representative, Dr Andrew Green, former Senior Police Officer Chris Phillips, Headteacher John Hayes, and from Downing Street, of course, our political editor, Andy Bell. First of all, Dr Andrew Green, the message very much business as usual from the Prime Minister, but a real sense of what might be to come, and it sounds bleak, doesn't it?
Well, I think it's very sensible to plan for things that might happen, but I think it's important that we all realise that we are in the containment phase at the moment. So at the moment, people should continue with their lives, but they do need to do the things that they've been advised to do, particularly about hand washing and about doing the right thing if you feel you are exposed, which is not to go to your GP, it's not to go to hospital, but it's to take advice from NHS 111. Now, preferably on the internet, so that the telephone operators can manage people who can't use the internet. But please do not go to your hospital or your GP. Take advice online.
And Chris Phillips, Boris Johnson outlining how the police might be brought in. Not yet, though. Police get ill as well, they don't.
Well, of course, that's the trouble, isn't it? The police are just normal people like everyone else and just as likely to get ill. And, of course, their families are just as likely to suffer as well. So it's not as straightforward as that. But, of course, the police have got plans in place to be able to backfill. But, of course, our society is very different from societies before. That how society reacts is going to be different than we've seen in generations before.
Let's see what the Prime Minister said about what he's going to do with the police.
There are long-established plans by which the police will, obviously they will keep the public safe, but they will prioritise those things that they have to do. And the army is, of course, always ready to backfill as and when. But that is under the reasonable worst-case scenario.
And Chris, sort of low-level crimes won't be dealt with. I mean, they just won't be.
Well, I think it's more about keeping the streets safe. I think you can expect crimes not really to be investigated, and a lot of police resources will be put into actually policing the streets. Because, of course, if you do leave gaps, if you leave a society that aren't going to get on with business as usual, then you're also going to get criminals that think that they're going to do the same as well. And, of course, the police have got to be able to respond to that.
John, you're a head teacher. He spoke about school closures. That's not happening yet. That's in the next stage. But what sort of effect would that have on you?
I think on us that would make things very difficult, particularly for our communities, for our parents. I'm head teacher of a primary school, and obviously if those children are not in school, then they have to be somewhere. If they're at home, they need to be looked after, presumably by parents who then won't be able to go to work. So the knock-on effect of school closure, I think, could be very significant.
Let's hear also what the Prime Minister said about schools specifically.
Would that help sufficiently in this particular epidemic if it were to be done as a way of pulling down the peak of the infection to justify the considerable burden, including, I have to say, to the NHS, which would start to lose healthcare workers who had to look after children at home?
That's the Chief Medical Officer, not the Prime Minister. Exams, for example, in the summer, it would have a massive effect on that, wouldn't it?
I think it would, and I'm sure that secondary schools will be making provision for that now and thinking about where they will, how they're going to manage that in the future. But at the moment, I think that what we're trying to stress with our community is to stay calm and to follow the government advice.
Andy Bell's in Westminster. Boris Johnson was accused, even this weekend, of not taking charge. Andy, how might that be assessed now, do you think?
I think there's a general view that the Prime Minister, for a while, shall we say, last week, was maybe a little bit behind the game on this. But I think as of the last weekend, and then with this launch of the plan today, I think there's much more of a sense that he has at least got a plan in place, that he, as you saw today, he had the Chief Medical Officer, he had his Chief Scientific Advisor either side of him, definitely giving a clear impression that we're across this. We have been planning. To be fair, Matt Hancock, the Health Secretary, has been pretty much full-time on this for some time now, but I think from the Prime Minister's point of view today, there will definitely be a belief that they've shown that he is now fully across this and has a plan in place.
Dr Andrew, in the press conference Andy was in, Boris Johnson talking about the containment stage. At what point do we move to the delay stage? What is it that makes it the next stage?
Well, we know that the numbers will go up. That's inevitable. What we don't know is the amount of that rise will be and when that rise will be. Ideally, we want it to be in the summer when the pressures on the NHS are less. Now, that decision will be made by the Chief Medical Officer, taking advice from his scientific advisors.
And there's a sense if it gets to the summer that things won't be as bad, perhaps, but I mean, that's false, isn't it? I mean,
well, the NHS is under enormous pressure at the moment. We have had a decade of austerity, and ideally, if you were going to plan for a pandemic, you wouldn't be starting from where we are. And I think the architects of austerity do have to take some responsibility for that. But we do have advantages too. We have a centralised health systems in all the 4 nations of the UK, and we also have been planning for this for a long time. After all, pandemics are not unusual. They come around every few years. We're in fact overdue for a flu pandemic. So the country is well prepared for this. I just wish we had more doctors, more nurses and more beds.
Chris, do you think these doomsday scenarios worry the public? I mean, when there were no deal preparations, the politicians often didn't go there, didn't talk about the army on the streets. I mean, documents leaked in the end and we heard the sort of plans, but today they're being quite specific, aren't they, about what might happen?
Yeah, and of course we also have to worry about the worried well, if you like, those people that won't go to work because they've got children that have got bronchial problems, or potentially those people that won't go to an office because the air conditioning may give them an infection. So all these things will come together. And of course, as I said previously, we're not like China. China was able to lock people down and tell people to stay in their houses. In the UK, that just won't work, and people are going to carry on as much as they can, business as usual, which will potentially make the situation worse.
John, what sorts of concerns are you getting from parents? I mean, it must be a daily thing of people wanting advice, perhaps.
I think part of the issue is parents gathering information from less than reputable websites and not following the government advice. And what we're saying is, let's be really sensible about this. Let's take the government advice. Let's use those websites and follow that guidance and stay calm and sensible about the whole thing.
And in all of your fields, I mean, we have never really dealt with something like this, certainly in the last few decades, have we? I mean, this is unprecedented, isn't it?
Well, no, I think the last significant flu epidemic was just at the end of the last century, about 20, 25 years ago. So we are in some ways in uncharted waters, but they're waters that we have prepared for.
And in terms of, I mean, what do you think?
Well, from a policing perspective, we have now more crowds than we've ever had before. We've now got more events going on than ever before. The summer is full of events, all of which need to be policed and secured. Will those go ahead in light of this? That remains to be seen. And
it's the keeping calm, as it was seen. University graduation ceremonies, I think at Buckingham, they've cancelled theirs in 2 weeks' time. But it's about keeping calm, I guess, isn't it?
I think it is, and it's also about trusting us. We're going to make difficult decisions, but we're going to make decisions based on the proper evidence and the advice we get. And we will always do it in the best interests of the children.
Guests, thank you very much indeed for your insights, both here and at Westminster as well. Thank you very much. Thank you. So, as we now know, certain groups can be more vulnerable to the virus, such as those with underlying problems like heart disease and diabetes. But age is a major factor too, with the elderly particularly at risk. So what's being done to make sure they're being kept safe? Layla Hayes has been investigating.
At the Bulsmoor Lodge care home in North London, they're doing a deep clean. The residents here are aged from 80 to 101. And staff are doing everything they can to protect them from the coronavirus.
We've got the housekeepers doing extra cleaning. Obviously, they have to do all doorknobs, lifts, plug sockets. We've got our carers, as well as the housekeepers and any management that come in. They have to clean their hands more often. But obviously, we've got to try and sort of like work through it if it was to happen.
How are you this morning?
Yes, not too bad at all.
Edith Martin is 90, but says she isn't worried.
Well, they clean everything. They're so clean. Every morning they do it, and even afternoon they hoover and clean everything.
And does that reassure you?
I'm sure they can't do any more.
The government has recommended social distancing to prevent the virus spreading, but carers here say that's easier said than done.
I don't think it is possible not to touch the residents because we are hands-on carers and the resident is also hands-on with us. It would be impossible. How can we tell a resident, when they ask us for a hug, we cannot give you a hug? That is sometimes heartbreaking, so we can't, it's not going to happen.
The elderly are likely to see the biggest impact from the virus. Preventing them getting it should now be everyone's priority. Layla Hayes, 5 News.
Well, among the many plans to ensure healthcare needs are met, the government might consider asking newly retired doctors and nurses to return to the NHS. Well, earlier I spoke to former GP Dr. Jonathan Plotnick in Grimsby, who retired 5 years ago, and I began by asking him his thoughts on the idea.
My first concerns were, of course, exposure to the disease itself. Those were my main concerns, because based on the current figures that I've seen and looking through them, the mortality rate for the GPs in that age group is going to be around about 2 to 3%, or maybe even higher if they have a coexisting illness. There are ways around this. If we consulted remotely using video conferencing, video links, that would be one way that we could possibly contribute.
And is it something you're considering doing? Would you go back?
I'm in two minds about this. There's a part of me that would want to contribute to a developing crisis, but also there's a self-preservation element as well. So at the moment, I'm in two minds about it. I'd like to know a bit more about how the disease and is evolving.
I guess the issue is, obviously, at any time, people have lots of illnesses, lots of diseases. That doesn't stop during this outbreak, does it really? There is all the other business that doctors need to do that is potentially not being done because of this.
Yeah, I think there would be very much a place for GPs, retired GPs, to help out in that situation. How willing they would be to do it, I don't know. I can only speak for myself.
Just the logistics of, if you go back and start doing this job again, sort of the paperwork, the re-registering. I mean, will there be a mountain of logistics to go through to start being a doctor again?
I think that would be the one thing that would prevent me doing it, and they would have to bypass that really to make this a feasible proposition, because re-registration and revalidation would take a minimum of 6 months.
And just something I wondered, I mean, if you're retired, are you able to prescribe medication? Is that one of the things that is sort of taken away when you retire?
You're not allowed to prescribe medication. You're not allowed to sign any documents in your capacity as a general practitioner. So, you wouldn't be able to sign death certificates, for example.
And as it stands at the moment, so you're on the precipice of deciding whether to do this or not. I mean, do you think it's likely you will end up doing it?
I could be persuaded, but it would have to get to a certain level where we were almost in a blitz mentality, a siege mentality.
Dr. Jonathan Plotnick, thank you very much for that. Thanks. Now, today, the Bank of England boss Mark Carney warned the economic shock caused by the virus outbreak could prove large. It says the US central bank cut interest rates in an emergency move over the evolving crisis. I'm joined now by financial analyst Louise Cooper and Louise Stewart from the Federation of Small Businesses. Louise Cooper, first of all, is Mark Carney being unnecessarily gloomy, do you think?
So the Federal Reserve in the States has cut interest rates by 0.5 percentage point, which by itself is a big move. Normally, they only cut by 0.25. It's the first time they've cut rates between meetings since 2008, since the financial crisis. And only a week ago, they weren't talking about cutting rates. So the very fact that that has happened tells you policymakers are taking this very seriously. The fact that stock markets last week fell 11% tells you that an awful lot of people think the economic shock could, and I stress could, because frankly, who knows what's going to happen, but could be significant.
What sort of steps did he say the Bank of England would take if necessary?
Well, I mean, in a way, he's sort of an outgoing governor. What the Federal Reserve, by cutting rates, it puts an awful lot of pressure on other central banks around the world to follow suit. Now, the point about the Federal Reserve is interest rates are slightly higher than they are in the rest of the world. We've had the Bank of Japan, we've had the European Central Bank, we've had the Bank of England, all talking about providing support to the economy, cutting rates, QE. And this morning we've had both the Central Bank of Australia and the Central Bank of Malaysia both cut rates. So we're moving into a world where central banks around the world are saying, we're worried about the state of the economy, we're worried about what that means, we are moving into a world of cutting rates. So in that environment, for a central bank not to cut rates, like if the Bank of England decided to do that, that's probably a no-no. The point, though, about cutting rates is it doesn't cause us all to go, let's go and have dinner at a nice restaurant. Let's go and jump on a flight to northern Italy for our Easter break. So interest rate cuts can really only provide a bit of sort of monetary support. They don't really change our behaviour. If 1 in 5 people are not going to be going to work, if we have a really bad coronavirus outbreak here, it's irrelevant how, frankly, where the Bank of England puts rates.
And Louise, Stewart, that is really going to impact small businesses, isn't it?
Hugely. We're already seeing small business confidence at its lowest level since the financial crash in our latest small business index. And members are telling us already that it's having an impact on things like the supply chain. That seems to be where they're feeling it at the moment. We've got members who have business interests in Hong Kong, in China. So obviously they're already feeling the impact. We also had members who told us last week they were meant to go to a big tech conference in Barcelona. They'd sent all their stalls there, their pull-ups, all the rest of it. They'd sent people there. It was called off because of coronavirus. So it's already impacting, but it's going to have a much longer tail because obviously if you were going to that conference in the hope of getting future business, then that obviously hasn't happened. And obviously there's a bigger concern for, our high streets are already struggling, as we know.
Are they quieter, do you think? They're not empty, but they're
exactly.
They're
not. We're not seeing the impact just yet, but after the conference we saw today, as Louise says, if 1 in 5 people end up not going into work, they're not travelling, they're not going to their, their local sandwich shop at lunchtime, the impact is going to be huge. So I think it's going to have a really long tail. It's not just about the next few weeks. This could be felt for months.
And in China, as an authoritarian state, they can impose behaviour on their population that we can't do. So they, if you look at the worst stage of the Chinese crisis, it's thought that about half of the factories are closed. Now they're coming out of that. Factories are slowly reopening. Maybe about 60 to 70% are now open. But you look at the Chinese experience. Well, they can set up cameras monitoring your temperature, and that's fine. And then if they see your temperature's higher, they can grab you off the street and throw you in. You can't do that in the UK.
And there's also the impact here, isn't there, of, over 90% of businesses are small businesses, privately run. So if you're running a small business, you've got to take that decision, do you self-isolate, etc., and the impact that has on your business if staff start not being able to come in to work, etc. And you were talking to the gentleman earlier who was a head teacher. If schools start closing and then parents saying, well, I have to be at home because my kids can't go to work, the impact is really going to have a huge ripple effect.
But Mark Carney at least stressing this is temporary. Potentially things may go back up quite quickly.
I'm sure my fellow Louise will, so the two Louises talking about money. So the question is it like a sharp collapse, which is kind of what we saw in China? The Chinese economy contracted, we think has contracted pretty heavily in the first quarter compared to the the fourth quarter of last year. So is it a sharp contraction and then a sharp rebound? Or is it a sharp contraction bumping along and a rebound? Or is it something a bit more sustained? Now, nobody can tell you that.
And
the one thing we would say, though, is one of the biggest issues, as you'll know, for small businesses is cash flow. Yes. And late payments. And at a time like this, if they're having difficulty accessing the supply chain, if their customers don't start to come, HMRC have already said they'll look more kindly, if you like, on businesses that are struggling at the moment. But, that can have a huge impact. It puts over 50,000 businesses out of business every year already.
And very quickly, if you read the government's 34-page response, unsurprisingly, it's a lot about health, as it would be. There's very little in there about businesses and the damage to the economy. Yeah. Although the one thing they did say is we will provide some cash flow support.
So we'll see. Louise Cooper, Louise Stewart, both Louises, thank you very much for that. Thank you. Now, the coronavirus could have an effect on the case of Nazanin Zaghari-Ratcliffe, the British-Iranian woman who's been detained in Iran since 2016. There's been an outbreak of the virus at the prison she's being held in. Her husband says she's displaying symptoms of it, but Iranian authorities insist she is in good health. Nazanin's local MP says she could be granted temporary freedom while the outbreak is dealt with. And the Pope has reportedly tested negative for the virus. He's been suffering from cold-like symptoms, has had to cancel several engagements. The Vatican has not confirmed the reports in the Italian media. Now, coronavirus has the potential to affect our lives in so many ways, of course, so many sporting events could be a casualty. The outbreak has already started to impact on several fixtures around the world, and now there are questions about the Tokyo Olympics. Earlier, I spoke to sports journalist Rob Harris, who's in Amsterdam, where a UEFA meeting is taking place, and I started by asking him what's been said about the virus so far.
I mean, UEFA are trying to avoid any sense of panic over the fate of Euro 2020 in particular, but it is a concern across the organisation, the impact of COVID-19. There's Champions League and Europa League games to deal with in the coming weeks. They've already played one game in Milan in the Europa League last week behind closed doors, and it's not really a sustainable solution for the loss of revenue for clubs as well. They need that ticket cash from fans to help fund the clubs, but ultimately the football bodies are listening to the governments, and it's the governments that are going to dictate what can be done and whether games can go ahead, let alone behind closed doors, but if at all.
Japan's Olympic minister as well today saying the Olympics and the summit could be postponed to the autumn. I mean, that would be absolutely huge, wouldn't it?
I mean, any delay to the games would have big ramifications across all sports. I mean, you've even got footballers who are taking part in the football competition who it'd be disrupted to their seasons. But when you've spent so many billions on organising an Olympics and building facilities like Japan, they will want the games to go ahead. The problem is, if the health authorities say that there's a threat to public safety, the health of the nation, then it would be very hard for those games to go ahead.
And just lastly, Boris Johnson saying here the government's position is one of business as usual. I think there'll be relief in Cheltenham, won't there? It's the festival this time next week. There were huge concerns that would be cancelled. I mean, that will obviously go ahead.
Yeah, I mean, there'll be determination obviously to get Cheltenham go ahead. I think we've seen in many parts of Europe just how fast-moving the change of sporting events can be. The fact in Italy, where some games were quickly ordered to be ordered behind closed doors when it seemed to be an initial threat to them, and then some games being called off altogether, that I think it really is the pace of the spread of the virus that can suddenly lead to decisions being made. But obviously there's horses to transport around, as well as many thousands of people mixing at Cheltenham, and the public health authorities will be concerned about such an environment leading to the spread of the virus and causing a greater public health issue.
Rob Harris, thank you very much indeed for that. Thank you.